Welcome to For Dharma Turn, where we bridge the gap between science and spirituality. Today, we're diving into the revolutionary therapeutic interventions and technological advances transforming brain injury recovery. From cutting-edge brain-machine interfaces to the promise of AI in rehabilitation, we'll explore how neuroplasticity is being harnessed to restore lives and reshape the future of healthcare. The understanding of neuroplasticity has revolutionized therapeutic approaches to recovery from brain injuries, offering new hope for patients and healthcare professionals. Intensive rehabilitation therapies, which include physical therapy, occupational therapy, and speech therapy, are based on the principle that repetition and intensive practice can strengthen synaptic connections and promote cortical plasticity. Studies have shown that the earlier these interventions are initiated after injury, the greater the potential for recovery, demonstrating the importance of early and ongoing treatment. These traditional interventions are complemented by innovative techniques that further expand the possibilities for recovery. Transcranial magnetic stimulation, TMS, and transcranial electrical stimulation, TDCS, are non-invasive technologies that use magnetic fields or electrical currents to modulate brain activity. TMS, for example, has been successfully used in the rehabilitation of motor functions after strokes and in improving symptoms of treatment-resistant depression. Similarly, TDCS has shown promise not only in motor rehabilitation, but also in modulating cognitive functions such as memory and attention in patients with traumatic brain injuries. Another significant advance is the development of brain-machine interfaces, BMIs. These technologies allow patients with severe paralysis to control external devices, such as robotic arms or communication systems, directly with their thoughts. By harnessing neuroplasticity, BMIs train the brain to use new neural pathways, offering an innovative alternative for recovering lost functions. Recent research shows that, with adequate training, these interfaces can partially recover motor functions, stimulating cortical reorganization. In addition to these techniques, virtual reality, VR, and augmented reality, AR, are gaining ground as therapeutic tools that immerse the patient in simulated environments that promote intensive practice of motor and cognitive tasks. These technologies offer a controlled and motivating environment where patients can repeatedly practice specific movements or tasks, facilitating recovery through neuroplasticity. The future of brain injury recovery, driven by neuroplasticity, is closely linked to advances in neuroscience, artificial intelligence, AI, and neuroengineering. Integrating these disciplines promises to transform neurological rehabilitation, making it more effective and personalized, with treatments tailored to each patient's needs. AI is already being used to analyze large volumes of neurological data, enabling the identification of patterns that can more accurately predict recovery and guide therapeutic interventions. Machine learning algorithms, for example, can be trained to recognize the signs of neuroplasticity in neuroimaging and predict which areas of the brain are most likely to respond to a specific therapy. This enables more targeted treatment, reducing recovery time and maximizing clinical outcomes. Furthermore, AI can help personalize rehabilitation therapies by adjusting exercise programs and stimulating patients based on their progress. Neuroengineering, meanwhile, explores the creation of advanced neural implants that can directly stimulate specific brain areas, promoting plasticity and facilitating the recovery of lost functions. These devices have the potential to treat a wide range of conditions, from paralysis to neurodegenerative diseases such as Parkinson's and Alzheimer's, offering new hope for patients who currently have few treatment options. Developing nano devices capable of interacting with neural networks at the molecular level also opens new frontiers in neural regeneration and treating brain injuries. In addition, integrating AI-enabled neurofeedback and biofeedback technologies offers a new dimension to therapy. Patients can learn to self-regulate their brain activity, promoting positive changes in motor and cognitive functions. The ability to monitor and adjust therapies in real time based on data collected during sessions makes rehabilitation more responsive and adaptive to individual needs. These advances signal a future where neurological recovery will be more effective and accessible. This will allow more patients to benefit from new technologies and therapeutic approaches, contributing to a significant improvement in the quality of life of those affected by brain injuries.